Surajit Santra. I'm a consultant pediatrician and neonatologist in Kolkata. My topic of discussion today is a childhood cough. And I'm pretty much sure that managing a child, especially at night, when the child is coughing very vigorously, is a real challenging issue for you parents. Now, just to brief you, why the child coughs at night. See, your child's airways and nose and the sinuses get plugged with secretions which trickle down to your baby's throat and chest and makes the child cough at night. Another thing is asthma, which again becomes a very irritant and sensitive airways, especially at night, so the child is prone to cough at night. Now my idea is to just discuss a few basic causes of childhood cough, especially at night. The first and foremost important is asthma. The second one is your common cold. The third one is a croup, that is a viral infection of throat. Another one is the acid reflux. Okay. Now, I think discussing all these few important issues will give a brief idea about how to use basic devices, home remedies to your child so that you can help your child to get rid of it till you get a medical access. Now coming to asthma first. See, what is asthma? It's a allergic conditions where the child coughs when the child is exposed to pollutions, dust, smoke, strong deodorant, perfumes like that. This is a airway of your normal child, and when it's exposed to this sort of allergic factors, it becomes red and inflamed like this. And in severe cases, it becomes constricted and the inner airway becomes red and mucus plug like this. So you have to give relief to your child by some inhalers, which are most of the times available at your home. And in smaller kids, you can use a device like this. The same inhaler you have to give to the baby's mouth. This is called spacer, which actually helps you to deliver the medicines to your baby's lungs and the baby gets relief at home. Other one is a common cold that you probably know is basically infection of throat and nose, and the child start having a lot of nose secretions, cough and fever. You can help your child by giving a saline water nasal drop and offer the child home available warm liquids like milk, soup, water like that. And obviously in younger kids, you can offer them to have a gargle in warm saline gargle. That will relieve the child's throat congestion. Third important issue is the croup or stridor. We call it a viral infection of the throat. There's a noisy breathing and barking cough, the child coughs too much at night. Sometimes if you can make the child in a cool, humidified area, it gets relieved. Obviously, in case of severe distress, you have to consult your doctor. And a small other cause is acid reflux, where it happens that the acid content of the stomach comes out to the food and air pipes and irritates the lung, and the child coughs. In those cases, we actually advise make your child little head up position, and if you have available medicines, some antacid preparations at home, you can obviously give so. These are more or less the basic causes of cough for a child, and I hope if you are aware of these basic conditions and their remedies, you can manage the initial things at home. Obviously, you can consult your doctors when you get your opportunity. Hope this piece of information is helpful for you. Thank you. Thanks for viewing.